The First Minister of Northern Ireland is on the line now. Good morning.
Good morning, Michelle.
What are the key indicators that you will be looking at as you assess whether it's possible to ease your lockdown?
Well, I think it is important to say that we've just heard about the vaccine development, and of course the vaccine will provide answers in the longer term. But in the short to medium term, we need to work out across the United Kingdom how we're going to live with the virus, and we need, of course, to continue to suppress it, to minimise its harm, whilst, of course, trying to restore some normality. And I very much hope, and I heard Matt saying that it is my preference that we work together, and of course it's my preference absolutely as well. We have been working together as four nations, continuing to decide what is the best way forward. But the two positions are not mutually exclusive, Michelle, because the point I was making is that we may decide as the United Kingdom on criteria which will mean that different regions will move at different times. And just to be clear, I wasn't suggesting that Northern Ireland would be the first mover. We're not out of the woods. We are not making a dash for the exit, not in any way. But what I was suggesting was that we may, as a nation, as a country, decide that there are different regions that will move at different times.
I see. So you'd have to have the signal, essentially, that the UK government is in agreement with with a different path being followed for Northern Ireland or another part of the United Kingdom.
Well, I think what has worked really well is that whilst, of course, we will do our own modelling in Northern Ireland, Wales and Scotland will do that as well. What has worked really well is the fact that we come together in Cobra and we talk about our different experiences, and sometimes they're very similar experiences. Very pleased to say that the trend in relation to Wales, Scotland and Northern Ireland is in a positive trajectory. It is in the downward movement, as it is in England as well. The point I was making was that when we decide on the criteria together as to moving into the recovery and the renewal stage, it may be that different parts of the United Kingdom, not necessarily Northern Ireland, it may be that different parts will move in a different way.
Yes, but it's clear, isn't it, already that in terms of the numbers of deaths, you are in a much better position, thankfully, than the UK as a whole has been. And therefore, you must feel the imperative quite strongly. You must be asking yourself that question in a more urgent way. Can we get back to some semblance of normal life?
Well, I think, as I said, we're going to be living with the virus for quite some time. We are going to be looking at the new normal, how we live in a way that doesn't allow the virus to become virulent again and to have a second wave that would cause death and indeed cause damage to our National Health Service. Because what we've been involved in, of course, is protecting life and making sure that we had a health service that was able to cope with what was thrown at it. So when we're moving to that new normal, we have to do so in a way that is careful, that is graduated, that takes a step-by-step approach, because if we do find that the famous reproductive moves above 1, in other words, that it does start to infect the population again, that we can move back again. So it is about a graduated approach, Michelle, and I think listening to colleagues across the United Kingdom, that's the approach they're taking as well.
But then give me an idea of what that graduated approach might involve for you. Take schools, for example. What are you thinking in terms of numbers in the classroom or the school timetable?
Well, I was very interested to see what Scotland was saying about that yesterday in terms of when schools will open. We are looking at repurposing schools. Perhaps some children will go to schools on different days. That's the sort of thing I think is a very sensible conversation. But I want to very much stress to you, Michelle, that we're not there yet. What we're doing is trying to plan for the future. We're in a situation where the public health message is still the preeminent message. It's so important that people continue to do what they've been doing in Northern Ireland, and I'm very proud of the way in which the Northern Ireland public have responded to the public health messages. They have stayed at home. They have social distanced when they needed to do that in public spaces. And therefore, we have benefited from that. So that message is still the preeminent message. But I think it's important as a devolved administration, as the UK government, that we move to a situation where we plan for the future, because whilst the virus is going to be with us for some time, it's important that we also try to rebuild an economy that is in a very bad situation at the moment. And of course, the economy and health are interlinked. I want to say that very clearly, because if you don't have an economy to support people to live in a particular way, then that's going to have an impact.
Arlene Foster, First Minister of Northern Ireland, thank you.
Well, let us stay with these themes at